In the last session, we have discussed about the HPV serotypes and the HPV infection. Today, we will be discussing about HPV vaccine. HPV vaccine is a prophylactic vaccine and it will not take care of the HPV infection that has already occurred. The vaccine is produced by the recombinant DNA technology. The virus-like particles are produced. The virus-like particles have the same L1 protein outer coat as HPV virus, but it has no genetic material. So it is not infectious. And the vaccine uses the VLPs as antigens to induce a strong protective immune response. How the vaccine works. After an intramuscular injection, the vaccine is given as 0.5 ml in the deltoid intramuscularly, and after the injection, antibodies are produced. The intravascular component will have the antibodies, and that antibodies will be accumulating, will be there in the endocervix, the transformation zone, and the ectocervix. Also, by transudation and exudation, the antibodies also will be there in the cervical mucus. So, antibodies are there in the cervical epithelium and also in the secretions. Also, in already infected cases, when you give vaccine, the vaccine will coat the virus that are coming and will prevent infection at a newer site. That auto-inoculation also will be prevented. When an infection occurs, as you see, the virus will infect the basal cells and then the virus replicates and also produce changes in the cells, and virus will be shed from the surface cells. But after vaccination, the antibodies will coat the virus, so the virus will not be able to infect the cells. The natural infection produces a very weak antibody response, but vaccination produces very high antibody response, and very high antibody levels are seen at the cervical epithelium, and that will prevent the HPV infection. Coming to the HPV vaccines available in India, the first HPV vaccine license was in 2006. The licensed HPV vaccine are the bivalent vaccine, that is the Cervarix. This contains the serotypes 16 and 18 that will prevent the anogenital, precancerous lesion and cancerous lesion and oropharyngeal cancers. The quadrivalent vaccines available are Gardasil and Cervarix that contain the four serotypes, that is 6, 11 and 16, 18. The 6 and 11 will be producing laryngeal papilloma and anal warts, and the 16 and 18 will be protecting against the anogenital cancers and precancerous lesion. So the quadrivalent vaccine will contains a 6, 11, 16, 18. The non-valent Gardasil 9 contains, in addition to 6, 11, 16 and 18, 31, 33, 45, 52 and 58. So that will take care of the 90% of the oncogenic HPV virus that causes cervical cancer, and also will protect against the laryngeal papilloma and also anal warts. Coming to the age and sex of vaccination target population, and also we will discuss about the upper age of target population for catch-up vaccination. What is this catch-up vaccination? The recommended age is 9 to 14 years. Suppose if they fail to take vaccine between this age group, they can continue taking from vaccination from 15 to up to 26 years. And also discuss about the recommended vaccine preparations. So the recommended vaccines are Cervarix, the bivalent vaccine, the quadrivalent vaccine Gardasil and Cervarix, and the non-valent vaccine Gardasil 9. All these vaccines are given in the dose of 0.5 ml IM in the deltoid, and we have already discussed the Cervarix contains 16-18, the quadrivalent vaccines contain 6-11, 16 and 18, and non-avalent Gardasil 9 contains the 9 serotypes 6-11, 16-18, 31, 33, 45, 52 and 58. And all these target population is 9 to 14 years in all these vaccine. And all these vaccine, if taken between 9 to 14, only 2 doses needed, 0 dose and 6 months dose. It is important that a 6 months gap is important for optimum immune response. So 0 and 6 months are the vaccine doses between 9 to 14 for all vaccines, only 2 doses. If you want to take above or equal to above 15 years, you need 3 doses, 0, 1 and 6 months for bivalent vaccine, 0 and 2 and 6 months for this quadrivalent and non-avalent vaccine. And as we said earlier, the 16 and 18, this bivalent, quadrivalent and non-avalent will all take care of the anogenital cancers, precancers, head and neck cancers. But quadrivalent or non-avalent, since it contains 6 and 11 serotypes, it will take care of the anogenital warts and laryngeal papillomas. All these vaccines can be given for boys and girls. The age group is the same. So, Foxy recommendation: bivalent, quadrivalent and non-avalent. License for use from 9 to 45 years. Preferred age 9 to 14. In this age group, you need only 2 doses. But who need 3 doses? If HIV infected, immunocompromised, having transplant or malignancies, or above 15 years, you have to take 3 doses. That is 0, 1 to 2 months and 6 months. So we have said about the 2 dose, the 3 dose catch-up vaccination, that is fail to take vaccine between 9 to 14, you can take between 15 to 26. Ideal to give it before indulging into sexual activity, but 15 to 26 age, if they had any sex, inform them there is reduced efficiency, but still better to take it because it will prevent a reinfection or a co-infection or other auto-inoculation. Above 26, up to 45 you can go. Suppose they have not any sex or few sexual partners or planning a new partner, then in such cases you can advise vaccination, but the reduced efficiency should be informed of. Then HIV positive and immunocompromised and those with autoimmune disease, malignancies or transplant need 3 doses whatever be the age. So interrupted doses, what to do? Suppose the age at starting vaccination decides how many doses to be taken. Suppose between 9 to 14 only 2 doses needed. Whatever interrupted can be continued. That is 9 to 14, if only 1 dose is taken, you need to take only the second dose. Suppose above 15 years, you have to take 3 doses. No need to start with the vaccine schedule. You can continue with where you stopped. Pregnancy, the vaccination is contraindicated. No need to test pregnancy testing before taking vaccination. But you found that you are pregnant after taking vaccination, don't get upset or afraid. This vaccine is not teratogenic and you can continue pregnancy. But don't continue with the vaccine schedule. You can continue the vaccine schedule in the lactation period. So what about the victims of sexual abuse? Suppose below 9 years, you can start vaccination at 9 years. 9 to 14 years, you have to take 2 doses. And at or above 15 years, they have to take 3 doses. Initiate the vaccination at the time of examination itself. Women with the history of abnormal screening reports also can continue take vaccine. Usually they will be above 20 or above 21. So you have to take 3 doses, but the reduced efficiency of the vaccine should be informed of. So the HPV vaccine is best given between 11 to 12 when she or she is at 5th standard, because the antibodies are produced at the highest in this age group between 9 to 14 years. You need to take only two doses, 0 dose and at 6 months. Vaccine is stored at 2 to 8 degree in the refrigerated, not frozen. Administered as soon as possible after being removed from the refrigerator. All the vaccines are highly immunogenic. Immunogenicity, efficiency and effectiveness are same for all these vaccines, but the highest immune response is seen between 9 to 14 years. You can administer the vaccine with other vaccines, but choose a different syringe and a different injection site. What about the interchangeable use of vaccine is not advised. You have to continue with the same vaccine you have started. But if that vaccine is not available, you can continue with whatever vaccine is available. The vaccine is contraindicated during pregnancy and those in persons with history of hypersensitivity to any vaccine component including yeast. Those having moderate or severe acute illness with or without fever, vaccination should be deferred till this acute illness is taken care of. The side effects are very minimal. Local reactions include pain, erythema, and swelling. The systemic reactions are pyrexia, headache, dizziness, myalgia, arthralgia, and gastrointestinal symptoms like nausea, vomiting. And the fainting attacks may be due to vasovagal syncope. So it is better to take vaccination in the sitting or lying down position, and you have to sit or lie down for 15 minutes after vaccination. So cervical cancer is preventable by the safe and effective HPV vaccination. This gives lifelong protection, no need for any booster. It prevents vulvar, vaginal, cervical cancer, genital warts and oropharyngeal cancers and anal cancers. And prevention is better than cure. So first prevent HPV infection by vaccination. But as you all know, all the serotypes causing the vaccination are not taken care of by vaccination. There are some other serotypes may also be there, even if some cross immunity is there. So continue cervical cancer screening. Why? Because after an HPV infection, 90% of women or the virus will be shed from the body, but in 5 to 10% of women, this virus will be remaining in the cervix, and it may produce cervical changes in the cytological changes in the cells, and it takes 10 or 20 years to get the cervical cancer after HPV infection. So continue cervical screening by cytology and HPV DNA testing till as recommended by WHO till 50 years and by SCOG till 65 years. So primary prevention by HPV vaccine and the cancer screening test will give you 100% protection from cervical cancer. So WHO targets 90-70-90, that is elimination of cervical cancer by 2030. For that, 90% of adolescents between 9 to 14 age should be vaccinated. 70% of women should be screened by a high performance test, that is HPV DNA testing by 35 and 45 years, and 90% of women with precancerous or cancers of cervix should have high quality optimum treatment. So what is recommended? We have seen 2 doses. WHO says that various studies have proved that even single dose gives adequate protection. So 1 or 2 doses between 9 to 14 years and 1 or 2 doses between 15 to 20 years, and 2 doses must be for above 21 years, and so the single dose schedule can be used between 9 to 20 years, that is WHO recommends. For males, the recommended vaccines in India, Savavac and Gardasil 9, they can be vaccinated between 9 to 45 years. 9 to 14, 2 doses at 0 and 6 months. 15 to 45 years, 3 doses, 0, 2 and 6 months. But Drug Control Journal of India has not approved this reduced dose schedule of WHO. They recommend 2 doses between 9 to 14 years and 3 doses from 15 onwards, and also 3 doses for the immunocompromised persons and HIV infected person. Cervavac is licensed till 26 years only. So we have seen how the HPV vaccine is to be given, and So, vaccinate between 9 to 14 years before indulging in sexual activity, and then continue cervical cancer screening to protect from cervical cancer. Thank you so much.